good afternoon, participant. So today my topic is deployment of technology for affordable healthcare. So we all know that healthcare must be affordable for everyone because healthcare is a necessity. Before going into the need of the development of technology for healthcare, let's have a look at the ground realities at the domestic as well as the global front. Today, India is the second largest populated country with increasing aging population. Around 8.3% of our people are 60 plus of age, and 65%, 6% are in the range of 15 to 64 years. For the large number of Indians today, access to the quality health care is inadequate, and the health system goals of access, affordability, and quality are still elusive to the masses. Focus on the prevention and wellness was limited, thus reflecting a highly unorganized primary healthcare system. Today, India is facing the triple burden of disease. There is unfinished agenda of the communicable diseases. Since our childhood, we are hearing about the malaria control program, tuberculosis control program, and other communicable diseases program. There is threat of emerging non-communicable diseases related to the lifestyle. Even in the rural masses in the recent years, and the emerging infectious diseases, we have recovered from the COVID pandemic recently. So India is at the crossroads, and our epidemiological triad is neither of the developed country nor of the developing country. We have not finished the agenda of controlling the communicable diseases, but we are facing the pandemic of the NCDs in the every section of the population. Financial implications of the non-communicable diseases are very high. In India, the total expenditure on the healthcare is around 4% of the GDP. Government of funding on the health was low, but in the last budget, it has been revised, and the health is on the agenda of the government now. Due to the neglect for the 7 decades, India lacks strong public healthcare infrastructure, and to cover this gap, now central government has come up with the idea of 2.73 lakhs health and wellness centers with the modern technology. Even today, the healthcare delivery segment is dominated by the private players in India. 70% of the total healthcare delivery is done by the private sector. And to our dismay, out-of-pocket expenses are very high. 2% of the people who are living below poverty line in India, they fell below the poverty line due to the health-related expenditure only. And our out-of-pocket expenses are higher than the poor countries like Nepal. Around 86% of the out-of-pocket expenses in private sector and 74% of that out-of-pocket expense was on the medicines only, drugs, and 26% was on the services. Shortage of skilled manpower and the skewed distribution of the manpower, trained manpower in India is a big cause of concern. If we'll compare with the developed countries, USA has 1 bed for every 350 the population. Japan ratio is 1 for 85, whereas India ratio is 1 to 1050. So to match the availability according to the standard of the international bodies, we need around investment of around $50 billion. Now let's have a look upon the problems faced by the patients. Non-availability of the proper medical services at the primary level, leading to wrong diagnosis and treatment by the quacks. Lack of timely and proper specialist intervention at the district hospitals in the case of the emergencies. Long waiting period for admissions, surgeries, diagnostic tests, and other super specialty services at the tertiary healthcare centers of the government. Very expensive services in the private sector, non-transparency in the billing, and the high out of the pocket expenses. So results are very upsetting. Let's have a look on the results of all these gaps. Death and disability due to the lack of the treatment. Wrong treatment for wrong diagnosis. Death, disability while waiting for the treatment, and high rate of complicated cases in which early diagnosis and treatment was possible. So there are large number of preventable disability adjusted life years. Why India needs deployment of technology in the healthcare? In the conventional model, healthcare was considered as a labor intensive industry. Manpower was the mainstay of the healthcare services. Even the Panipuri wala of our city is more high tech than any specialist doctor sitting in his OPD. Till date, till the recent years, technology and the healthcare were considered as two different domains with no or very little overlapping. So why we need technology? 80% of the qualified doctors are concentrated in the urban areas only, and 75% of the healthcare infrastructure, right from the beds to the labs to the ICUs to the OTs to all kind of the infrastructure is in the urban areas, whereas only 27% of the total Indian population resides in the urban areas. As per the Indian public health standards, these figures are from 2019. Due to the COVID, these are not updated. Only 11% of the sub-centers, 13% of the primary healthcare centers, and the 16% of the community healthcare centers in the rural Indias, they meet the Indian public health standards. And now, due to the emergence of the non-communicable diseases, as we all know that non-communicable diseases took a long time to cause irreversible damage to the human body. So we have a long period to intervene and to prevent the fatal outcome and the morbid condition for being developed. So now at each step, the patient's relatives, medical team feel helpless. What do I do now? Healthcare currently, as we have discussed, faces the challenge of poor access, low affordability, and high variation in quality. To achieve that goal, we must promote the Indian think tanks in the field of health planning. Professionals working at ground level can innovate out of box healthcare delivery technologies and solutions to the existing roadblocks. Innovative technologies are wonderful enabler and ultimate empowerment. They can make the quality healthcare accessible and affordable to each and everyone. According to our experience, 90% of the healthcare needs in the rural and remote areas at the 90% of the times can be met by only the provision of good primary healthcare services. Only 10% of the unmet needs need the tertiary healthcare or secondary healthcare interventions. So, till recent, it was paradoxical situation. More and more technical intervention was being done only in the tertiary healthcare field, and the primary healthcare field was left out of the technical bandwagon. Nobody was focusing on the primary healthcare where the need of the intervention, need of the development of the technology was the most. So now let's see what are the trends today in the healthcare and wellness. Now the mankind is focusing on the enhanced intelligence, increased attractiveness, extreme aging, optimized diet, digital biometrics, ubiquitous and continual monitoring, enhanced strength, digital hardware enhancements, sports optimization, disease-free body, enhanced sensing. So here are few trends in the healthcare spending and digital data revolution. Frequency at which healthcare data doubles is only 24 months. At the gap of every 2 years, the generation of health data doubles, almost 50% per year growth in the generation of health data. 39.7 million apps are currently being used by the smartphone users across the globe. 70%, 75% patients are expected to use digital healthcare services in the near future before 2030. 20 to 30 billion internet MOT devices will be there by its old data by 2025. Around 150 exabytes healthcare data today is stored in the servers of these apps. Around $47 trillion is the estimated global economic impact of the chronic diseases by 2030. Only diabetes in India will be costing us around $7 trillion by 2030, only in India, not talking about global. So, why we are so enthusiastic about the digital healthcare interventions to deliver the result which was not delivered in the last 70 years of the manpower intensive strategies. If we will look at the global trends, total population is 7.83 billion. Out of this, urban population is 56%. 5.22 billion people are using mobile phone. And 4.66 billion people are using internet. And 4.2 billion people are active on the social media globally. If we talk about India, total population is 1.39 billion. Out of those 1.39 billion, there are around 1.1 billion mobile connections which are being used by the Indians today. And the 624 million Indians are using internet. And 448 million Indians are active on the social media. So this penetration of technology makes a very good circumstantial evidence situation for the digital intervention to make primary healthcare accessible, affordable at the first point of the contact of the patient. In the last 60 years, computing power has improved by 1 trillion times. So data science, wearable gadgets, they are growing at an exponential rate. Personal profiling of patients by analyzing their life profiles, including social, personal, health, financial, and job profile extra, will change the outlook of the healthcare industry, particularly of the primary healthcare industry in the coming decades. So, in the coming decades, there are few trends: augmented and virtual reality, Internet of Medical Things, artificial intelligence, blockchain, and robotics. They will change the outlook of the healthcare industry within the coming years. AI products like IBM Watson, Oracle, Sophia, from companies like Tesla, Uber, and Volvo will be more sophisticated by 2022 and will be actually in the field delivering the primary healthcare facilities to the rural masses. 3D printing will be open doors to the bionic body part processing. Automation in the health tech business will ride in three waves: algorithmic, augmentation, and autonomy. 5G will also support 1000-fold gain in the capacity connection of at least 100 billion devices and making telehealth much more near to the physical OPD services and will enhance the availability of the specialist services among the rural masses, particularly in the low income group countries like India, where the ubiquitous availability of the specialist is still a distant dream. So, as we have discussed, right now the focus of the technology deployment is more on the primary healthcare delivery. In the recent decades, for 3-4 decades, it was more on the tertiary healthcare. As 90% of the population, they need quality primary healthcare. So with the recent advances in the mobile telephony and the internet and its application into the healthcare has paved the way for the technicians and clinicians to collaborate and to develop a robust, sustainable primary healthcare delivery platforms for the telehealth and the digital health. And also the data available across the globe is enabling the implementation of the artificial intelligence and machine learning in the healthcare. As we all know, healthcare is a very sensitive field where we have to take care of the acceptability and the ethical part of the available services also. So now let me tell you what we are doing at the Center for Innovation and Biodesign. Center for Innovation and Biodesign was established around 3 years back in the PGIMR, and there was a brain trust. Our mandate was to identify the problem statements where the technology can be deployed, and then development of the health tech solutions and their validation and testing, and then the health tech funding, policy support and connectivity, and the global visibility to these solutions which are supposed to be invented by the startups. So we have a brain trust of the multiple technical as well as medical institutes in the region, right from the IIT Ropar, IIM Kolkata, IIM Rohtak, IIT Roorkee, Thapar Institute Patiala, NIT Jalandhar, Punjab University, Ryatbara University, Chitkara University, Chandigarh University, and many more. So, with the availability of a common platform for the clinicians and technocrats, it was a win-win situation for both the domains. Clinicians they were dismayed with the available technologies which can be deployed for their bottlenecks. And the technocrats, they were also empowered with the real scenario, ground picture, and the problem statements, real-time problem statements, because earlier they were working in a hazy atmosphere and with ambiguous goals. So, with the collaboration of the clinicians and technocrats, we are able to file 19 patents in the last 2 years only. And out of those 19, 3 has been granted also. And around 9 products are clinically tested, validated, and are deployed in the healthcare field. One product which is very useful in the coming times, I must discuss with you, is the telehealth kiosk developed by the Center for Innovation and Biodesign. We have integrated multiple technologies in a single platform by a joint team of clinicians and technocrats of different streams. We have automated all the vital fetching, integrated the audio-visual conferencing with the doctors, and we have integrated multiple diagnostic labs in that kiosk, right from the digital spirometry, 12-channel ECG, digital stethoscope, and autoanalyzer, biochemistry autoanalyzer with 67 blood tests and one urine autoanalyzer. So it's a wonderful tool for the periphery to make the quality healthcare accessible at first point of contact. We have deployed this kiosk in the remote areas of Himachal Pradesh, one in the Thonag district Mandi, a very interior place in the Mandi district. Another is Avadevi at Hamirpur. Third is Thanakala in Una. One such kiosk is also established in the this Ilampe Mall near us, just to demonstrate the technology for the medical and the technocrats working in the region. So our experience is very delightful. With the simple application of technology in the primary healthcare, we have come up with multiple outcomes. First, in the peripheral areas, still today, the healthcare seeking behavior is event based. People used to go to the doctor after an event only. They never, they are not very keen to avail the preventive and promotive services because they are not available in the community. So technology can bring this gap, because for the marginal population, time is also money. So all these recent developments in the technology, as well as the percolation of the technology among the population, makes us a fit case for deployment of technology in the primary healthcare. So it's high time to come up for the clinicians and the technocrats to join the hands and to identify the bottlenecks and to identify the appropriate technologies and their appropriate application in the field to bridge all those gaps which we have discussed just few minutes back. Because 35% of the carbon generation in the healthcare industry is sheer due to the OPD related traveling of the patient. So we can enhance the penetration of the quality primary healthcare services among the marginal population. We can greatly cut the time required to avail those diagnostic as well as consultative services. We can greatly reduce the out-of-pocket expenses with the availability of such uh, services. I would like to discuss one case. At Avadevi, we have mapped few patients. So there are patients who need the intervention of the neurologist or the cardiologist immediately in the post-COVID era, because after COVID, the cardiac and neurological complications were very common among the recovered COVID patients. So in the usual setup, they have to travel to Hamirpur for availing the medical specialist consultation. Then again, they have to go to Hamirpur for the blood test. And on the third day, they finally got the prescription. And in case of uh, any super specialty consultation was advised, they have to travel to Shimla or Chandigarh and have to spend 3 to 5 days at Shimla or Chandigarh to complete that single consultation. With the application of the digital and telehealth diagnostic tools over there, so it was done within 3 hours of period in a single day, greatly reducing the expenses as well as the time and encouraging the people to avail the facilities. So the ratio of the patient seeking healthcare in a preventive mode increases very exponentially. So our experience of deploying the technologies, already developed technologies in the primary healthcare is wonderful. And particularly for the early diagnosis and the early treatment of the diseases, and it greatly reduces the burden of the morbidly sick patients among the population, and it greatly enhances the social stability also, because the need of traveling out of the community reduces greatly, and it amazingly reduces the out of pocket expenses. So it's high time for all the countries with low and middle income group. So India has a strong technical base in all the domains, and we have led the digital and the software revolution almost 3 decades back. Now it's time for us to lead the digital health revolution on the global stage to make the healthcare services available to each and everyone, to the last person in the line. And one more thing at the end I want to add, that it's not only the marginal population in the lower and the middle income group countries, but even in the developed countries, even in the rich countries, healthcare is very elusive to the marginal people. In a country like US, for a person without insurance falling sick is the scariest thing on the earth. Even for a traveler visiting in US without medical insurance and uh, availing a medical insurance policy in US is very costly. And even after availing the medical insurance, and even after paying the fat bills of the medical insurance, the time required to avail the medical services is also not very short. So even this technology can be a wonderful enabler for the developed countries also, but for the developing low and middle income group populations, particularly with the low penetration of the medical services, now it's opportune time for us to make the primary health care available, affordable, and accessible to everyone with the technical interventions. Thank you.